Assalamu alaikum. Another musculo MSK station. This is 5 years old Arif presented with left shoulder pain. Please examine her or him. So, first of all, whenever we don't know about the situation, first wash my hand, introduce myself, and taking permission. And there is a opening statement that there is a shoulder pain. So maybe musculoskeletal station. So we can ask 3 screening questions that I have mentioned in the previous audio recording. And then for inspection, as there is mentioned, there is shoulder pain, so we can look at the shoulder for inspection, palpation, and the movement. In the inspection, we can see that there is a high right-sided shoulder joint, and scapula is going up, and scoliosis is also present. And there is whenever we ask the child to put then we will ask the child to put his hand on the wall, so there will be more prominence. Wing of the scapula is present, especially on the right side. And then palpation for any pain on the shoulder joint present or not, because the opening statement one was that he was complaining of the left shoulder pain. And after palpation, the movement. So for movement, and as I'm from Bangladesh, so for better help in our friends, so we can say that for the flexion movement, হাত দুটোকে একেবারে মাথার উপরে দাও, এরপর হাত দুটোকে নামাই নর্মাল পজিশনে। Whenever the hand is above the head, there's a flexion of the shoulder joint, and then the extension, opposite direction is this extension of the shoulder joint. And then abduction. Put the hand above the ceiling, to the ceiling, and this is the abduction, and adduction is embrace yourself. And then rotation, just put your hand on the side of your body and then rotate. It is the rotation. So this is the movement of the shoulder joint. And after shoulder joint movement, we can see there is scoliosis present. We can ask Arif to touch the floor without bending your knees, and we want to see the scoliosis is disappear or not. Is it true scoliosis or functional? And from this we come to know that there is it may be case of short neck, so it may be Klippel tunnel. So the Klippel feil cervical vertebral fusion syndrome. So we can come to the chest, and we are looking for the chest deformity present or not, and cardiac assessment can put on a stethoscope if time permits. And to complete my examination, I want to measure the vital sign, anthropometry, upper segment lower segment ratio, and lung function test, as there is a scoliosis is present, and full cardiovascular and respiratory system examination, ENT examination, and Pegels of upper limb and the lower limb. And my differential diagnosis is maybe Klippel feil syndrome, it may be short neck, it may be Turner syndrome, Noonan syndrome, and skeletal dysplasia. So if it is Klippel tunnel, what investigation? It's a autosomal dominant, may autosomal recessive, so genetic test. And also the extra radiology, echocardiography, there may be ventriculoseptal defect present. And as there is a scoliosis, so spirometry for restrictive lung disease present or not. And there is short neck, so maybe obstructive sleep apnea, so sleep study. And also X-ray of the spine to see the level of the scoliosis and fusion of the vertebra. What is the level of the fusion of the vertebra, and how will you manage? I want to take the focus history, review his previous note, read book, and to go through the management with multidisciplinary team. And team member will be cardiologist, nephrologist, pulmonologist, occupational therapist and physiotherapist lies with school for building and transport and genetics. And some theoretical knowledge about the Klippel cervical fusion syndrome is the congenital bone disorder characterized by abnormal fusion of two or more cervical vertebra, and there is 4C. We can easily memorize by cervical fusion, cleft palate, cardiac VSD, chest deformity. 4S, there is scoliosis, springal deformity, short neck, short stature. 4L, low hairline, temporomandibular joint restriction, low set ear, limited limb wave neck, and hearing loss. Thank you.